everyone, it's Diana and welcome back to another video of mine. This time I'm talking about what it's been like for the past year of being a registered dental hygienist. If you're new here, I'm Diana and I'm a registered dental hygienist. I've been making videos about my life regarding dental hygiene, just anything going on that I want to share with you guys. So if you want to see more of my stuff, please go ahead and subscribe. I would very much appreciate it. I can't believe it's been a year since I've graduated dental hygiene school. I want to say since my last update video, which I'll make a playlist for so you guys can watch if you haven't already. I feel as a dental hygienist, I've improved significantly. I've just been more confident in my cleanings. I still have, well, let's just say instead of like a full bad day of cleanings, it's more of a few patients here and there kind of thing. I want to share in this video with you guys what I've been doing, what I've done to improve, so that you can be more confident as a registered dental hygienist a lot faster than I did. I'll be talking about what I did to improve, some of the pros and cons of what I have learned so far about the profession, and just review my life in general of what it's been like for the past year. The year kind of started off a little, let's just say, interesting. I had quite a bit of time from when I had my board exam to when I actually started working. It was all due to paperwork, of course. So in that time, while waiting, I took a few shifts at a dental office to work up at the front desk, and that just told me everything I needed to know, that I made the right decision in not pursuing medical office assistant or being a front desk receptionist at any job. I have so much respect for people who do that. It's so difficult, and dentistry is like on a whole other level with a lot of treatment planning and stuff like that, and grateful to have that job that gave me a little bit of money while I was waiting for my license, but I could not do that for the rest of my life, that's for sure. Just to kind of get back into the timeline of things, had my board exam, waited I think a little over a month, maybe about a month for my results, and then I could finally apply for my license, had to wait for my license, and then I could finally work. So my first shift was the first week of April of 2022. So that's 4 months of waiting around, which absolutely sucked. I definitely felt like I was kind of thrown into the deep end, not intentionally. It's just the way that it happened with the type of office that I am working at. While at the time it was really stressful, I now feel pretty confident in my cleanings. Still, of course, lots to learn. Will learn, but I don't hate myself at the end of the day like I was at the beginning, feeling terrible and thought I made a mistake, thinking I was never going to get better. I want you to know that those are probably all normal feelings, and I want to say by the month 10 to 12 months after you're full-time working continuously, you'll kind of start feeling a little bit better about how you're doing with your patients. So while very stressed out this past year, majority of the year I'd say, there's just been a lot of good things and bad things that happened with the job, obviously. Right out of the gate was, I actually posted a video on it, was when my first paycheck didn't go through. They held my first paycheck at a new bank that I was trying out, and it just really sucked having, you know, waited 4 months, have a little bit of income but not much. It wasn't like a good pay, it wasn't anything comparable. Getting this paycheck and then them holding on to it for more than 2 weeks because it was a brand new account really messed me up. I was super upset. Money was a big reason as to why I went into dental hygiene, so for that to happen really shook me up. I know it's stupid, but 4 months of waiting to start working, feeling like I was starting to forget things, and then my paycheck doesn't go through and I end up having to borrow money again from my parents. It just sucked. It sucked so bad. But on the bright side, you know, after a few paychecks, I was able to pay off a credit card and finally be able to buy stuff that I needed, that I was being really stingy on. It just made my life so much easier, that I'm forever grateful for my past self for putting myself through hell of school and wanting to change my life. And yeah, I can't say enough how happy I am that I made a decision to go into dental hygiene. The good far outweighs the cons, at least for me. I know some people have had pretty bad experiences, but I want to say that there are good offices out there. There are good people out there. You just have to, I think, have goals outside of just work to kind of keep you motivated and get you up in the morning to go to your job and get it done. How I improved my skills, or how I feel like I improved my skills. So it was a lot of asking questions, asking my fellow students, anyone that I knew for help, and then practice, practice, practice. So for example, if there was a patient that I had struggled to clean something on, I would ask questions, research, Google, try and figure out what I could have done better. And then the next time I had a patient that was similar to that situation, not even just on that like one particular tooth, I would practice what I would need to do to get that calc off. Think of it as, that's why they call it a dental practice, because you're practicing in real life. School is nothing like the real world. School is very much focused on documentation and stuff, which is really important. But when it comes to the actual cleaning part, I feel personally I learned way more outside of school than I did inside school. I guess a plus of being able to practice on real people is that people who aren't in dentistry have no idea what you do. Pros and cons. They don't appreciate or acknowledge or understand just how important your teeth are to your overall health. That's the crappy part, but the bonus part is they have no idea what you're doing in their mouth. So if you miss a piece, you just have to accept the fact that you're gonna miss stuff. There's not enough time usually, and most patients, you know, aren't gonna want to come back because you only missed a piece of calc on the distal of one of the teeth, and it's not worth taking up an hour an appointment. So as long as you're just good on your documentation, you've tried your best, you will get to a point where you feel like you've gotten most of the calc off. I'm sure I still leave some deposit behind. Absolutely. All the things that we need to do in an hour appointment feels impossible. So I just have been spending quite a few months just accepting that fact that it's out of my hands. And the best that I can do is the best that I can do. I can't do anything more. Have them come back at a shorter interval. So I've just recently started seeing repeat patients, and I am finding I'm cleaning up my own messes from when they came in last and stuff like that, and getting in a thorough cleaning. I think going into dental hygiene once you're out of school with that idea in your head that you are going to expect to do bad cleanings might mentally help you in the long run, because you won't be beating yourself up so badly about it. I've talked about it in previous videos, but one thing that helps me kind of speed things along is multitasking. As they're walking in, I tell them where they can place their stuff. I'm asking if they have any concerns. You know, I go, while you're getting yourself situated, can you let me know if you have any concerns, any problems to report, any changes to your medical history, so that they're talking while they're sitting down. So I'm putting on the bib on them while I'm asking them if it's okay if we do checkup x-rays or whatever is needed, you know, first. Put the lead diaper on, ask questions. Do they have any sensitivity to report? Would they like polish and fluoride that day? Just keep asking questions while you're moving around. And I like to obviously have everything prepared beforehand. So being prepared for your patients at the beginning of the day will really help. Once you are a little bit faster, so I'm at that point where, you know, if I come back from lunch 5-10 minutes late, I can pick up the speed and get my patients still done within the hour. But definitely at the beginning, I need to make sure that my bite wings are ready to go, that if the patient needed topical or LA, everything was set up before. The floss was there, the fluoride trays were there, the varnish was there, whatever I needed was all there so that I wasn't running back and forth. I also like to, on our daily sheet that's posted in my operatory, under each patient, I would write out like needs bite wings, just so I could physically see, especially if I'm running late with a patient, I can look up and see, oh crap, I have to do bite wings on this next person too. Or, oh yes, they're just a perio patient today, I don't have to do polish and fluoride, so I can, you know, be 5 or 10 minutes late with this patient and still finish on time with the next patient kind of thing. So it's very, very high paced, at least my office, okay? If someone cancels, my office can fill that appointment in very quickly, very easily. I don't have time to look at my phone, just barely. It is. It's like I blink and it's 5 o'clock already and I'm done for the day. My day is, yeah, super, super busy and can be intense. And I think, of course, that's what's kind of helped me get a lot better at my cleanings and be a lot faster. Also, while cleaning, I have figured out the perfect sequence for myself to get everything done faster. So specifically with the cleaning, I like to go in with the ultrasonic. I say my spiel as I'm letting the water run through, which is, here's a section for you. You can use that whenever I take a break. I take them frequently to let you be able to get rid of the excess water in your mouth. I'll be using my own section to help with aerosol. I just do my spiel. And then I always say, I'm going to be starting on your lower left side. Let me test it a few teeth. Let me know at any point if there's any discomfort. Some patients are particular. They need to stop and use a section every 3 seconds. Other patients, I can do a whole quad without having to stop. And I've just kind of also started thinking more along the lines of, let me use the ultrasonic for areas that I know are particularly difficult for me to clean up with regular instruments on my own. Areas that I know every time I've gone in with regular instruments, I'm like, why is there still so much buildup? I will spend some extra time with the ultrasonic trying to get that as clean as possible. And then obviously one area that I'm still struggling to this day, and I've been trying is the surfaces towards, I'm right-handed, so the surfaces towards on the lingual side of the max anteriors. I just have a really difficult time adapting the instruments to it. I know it hurts patients. I cannot figure it out. So I use the ultrasonic for that area, the green tip and the purple tip, to get as much calc as I can off with that, because I know I struggle with that particular area so badly with instruments. Easier and faster if I do it with ultrasonic than rather struggle and do it slowly with an instrument. So once I'm done that, then I go in and actually polish, and I polish quickly because the ultrasonic, to be honest, gets rid of most of the stain a lot better. So I will do a lot of stain removal with the ultrasonic, and then I'll go back in with the polish. For the most part, I'd actually, if I could, I'd skip it on most people because they really don't need it. But people like to think that's the actual cleaning part of the hygiene appointment, even though it isn't. I do the top teeth first, give a rinse, do the bottom, give a rinse, and then I floss. By the time I get in with my regular instruments, there should not be, there's like very, very little plaque left in the mouth. And so all I'm doing by the time I've gotten to that point with scaling is scaling the stuff off that needs to be, not the stuff that the patient could technically clean at home, which is the plaque. And then either I probe at the end or probe in the beginning. For the most part, you should be probing at the beginning, but for me, the type of patients that are coming in have a lot of plaque on their teeth and buildup. My office is very, very difficult. It's not easy at all. So when I go in there to probe, first thing, I'm getting inaccurate readings because of the calculus. It's taking too much time. If I have to like jump around the calculus, and the plaque too coming out, I can't read the readings. There's so much plaque on the teeth. So I just let them know at the end that when I've done the readings that, you know, it could be a little bit due to the inflammation from my cleaning, but now that we have it in our system, we can kind of keep an eye on things going forward. It's never, you know, making the pockets jump from like a 2mm pocket to a 4 because it's inflamed kind of thing. It's never like that severe. It's just I literally cannot see with the amount of plaque that is coming off every time I go in there when I try and do it first thing. So I find when I do that, and also stick to a specific sequence in the ultrasonic and scaling. So surfaces towards, surfaces away, anteriors. I remember where I've left off if I had to stop for a second. It just seems to go much faster for me. So pick something that works for you. I find leaving the anteriors to the end keeps me moving a little faster because I look at the time and realize, oh, I only have this much time. I can't, you know, spend all this time trying to get off every little piece of calc. So doing the anteriors last really forces me to speed things up as fast as I can, safely, of course, and get done on time. So I wanted to address this question on here because I get asked it a lot, which is, do I recommend temping straight out of school? And it's not a clear yes or no answer. It definitely leans more towards no, don't temp straight out of school, but it depends on your background. So the only time I would really recommend going for it if you want is if you have no other option. If you've already had dental experience, like you've been a dental assistant, you've had dental experience in the back, not necessarily the front reception area. That really won't help you much other than in terms of billing. If you have experience with sterilization, know how an office works, understand that every dentist has like different terminology. Like when I started at my office, they were still using tartar as the word for buildup on teeth, and I just say calculus now. But that's like a little example of how things are different at each office. They use different materials, all this stuff. The dentist might expect you to be able to do CDA stuff. I very, very much recommend sticking to one office, one or two, just to be consistent and make sure that you are getting the grasp of hygiene at that one office or two offices, whatever, you know, if you need to work at more than one office for the sake of filling up your schedule. Temping is just too difficult for someone that's also like me. Like, I like knowing where things are. Half the time when you're temping, you're running around like your head is cut off because you don't know where this is, you don't know where that is. You might get put in a shitty hygiene room like me where the original hygiene room flooded, so I was put into the surgical and everything was just so awkwardly placed. It was just the absolute worst. It was so stressful. Like, the money I made, I was proud of myself for getting through it, but I haven't temped since because I just did not like that experience. Not to mention that I also have a problem with working interviews, especially if you're a new grad, because you're walking into a place with no idea how anything works, and I really hope that those offices take that into consideration when people are doing a working interview for the first time, that they might not know the software, might not know where things are, and that in turn makes them run behind on every patient. Do I recommend it? Yeah, like I said, if you're that type of personality that likes the chaos, has dental experience, go for it. If you don't, I feel like you might end up not liking being a dental hygienist, and feeling really shitty about your skills as a hygienist, because your mind will just be focused on the time and not the actual like cleaning part. So I do think temping would get you faster in terms of scaling, finishing the appointments, but do I think it'll get you better at cleanings? Not necessarily, because you're not seeing those patients back after 3, 4, 6 months or whatever the interval is. You won't be able to see areas that you missed, and do it at your own risk is what I would suggest with that. So after all of this 1 year, would I still recommend this profession? I would say yes. I definitely would, but I'd give out a big warning as to what to expect, what not to expect. It's paid very well. There's a lot of pros. You have a lot more work-life balance, which is something that I was striving for when I decided to go into hygiene. So I think that's why it's worked out well for me, because it was always not the only thing that it was about, but a big part of being in hygiene for me was that I could have the weekends off, or I could have days off, and I wasn't working all evenings and 12-hour shifts and working until I passed out kind of thing. That's one of the pros of being a hygienist, is you can create your own schedule. The money is good. You're getting paid generally the same amount as people with more experience when you're coming right out of the program. The cons are, you know, some places don't offer benefits. It's a lot of back pain, it's really hard on your body. A lot of people, like I said, don't understand the importance of oral health, so your job kind of gets diminished to just clean my teeth. But even with all of that, at the 1 year mark, I'll do another video in the future, I'm sure, at 2 year, 3 year, whatever, however long I'm on YouTube for. But as of right now, yes, everything, all the struggles that I've been through has been completely worth it to get to the point I am at now, and I am very happy. Let me know down below if you have any comments or questions to ask. I'll try and answer them down below or in another video. If you want to see more of my videos, my updates, I've created a special playlist. I'll post it somewhere here. You can go ahead and watch all the other videos. Thank you guys so much for watching. If you haven't subscribed already, please subscribe. Very much appreciate it. And thank you guys again for tuning into my videos and sticking to the very end. I'll see you guys next time. Bye!